In this video, you will learn proper hand washing, gowning, and gloving in order to prep you for surgery. First, you will need to gather your supplies. You will need a sterile autoclaved surgical gown pack, sterile surgical gloves, a sterile scrubbing brush with a cleansing agent, a sterile mask, as well as sterile shoe covers. Once you have gathered your supplies, you're ready to start prepping for surgery. You will have to tie your hair back, especially if it's long. You can put it up in a bun or a ponytail as long as it's out of your face. Also, take off all of your jewelry and set it aside. Then put on your surgical cap, covering your hair and going over your ears. Also put on your surgical mask, going behind your ears and covering your nose and mouth. Put on your surgical shoe covers, being sure to only touch the insides and slide them gently over your feet. Next, you will need to open your autoclave surgical pack, checking to make sure that the tape has the black marks showing that it was properly autoclaved. You're going to use the tab and pull back the tape gently. Open the pack using the tabs that were folded and provided for you, being sure not to touch anything on the inside. Open the second pack, again making sure that the tape has the autoclave stripes. Again, use the tabs to gently open the pack, being sure to not touch any of its contents on the inside. Check the surgical strip on top of the pack and make sure that it has a black strip so you know it was autoclaved. Next, open your surgical gloves. Take the tabs provided and pull out, making the pack face up and away from you. Do not touch any of the contents inside the pack. Next, take the package inside and use the tabs provided to gently pull back the paper, exposing the gloves, being sure not to touch anything inside. The next step is hand washing. The purpose of this is to reduce the microbes on your hands because the hands come in the closest contact with the surgical site. First, open your sterile scrubbing brush using the tabs and pulling out and away from you. You can then take the brush and apply water and soap so that you can use it later on to scrub your hands and forearms. Turn on the tap water and adjust the temperature. Begin to wet your hands. Take a file or a pick and start to clean out your nail beds by scraping out any dirt that's underneath each one of your fingernails. Also be sure to keep your forearms above your elbows at all times. Using your cleansing brush, begin scrubbing your fingers. For each finger, you should be scrubbing each one of your 4 planes using 20 strokes.
Don't forget the other hand.
Once you finish scrubbing each finger, you can take your cleansing brush and start scrubbing your hands and forearms. Using a circular motion, you should scrub the back of your hand as well as your palms and in between your fingers. You should also go down your forearm, continuing the circular motion until you reach about 5 centimeters below your elbow. Repeat this process on both hands and both forearms. After you finish scrubbing your hands and forearms, you can discard your brush and start to rinse your hands. Again, be sure to keep your forearms above your elbows at all times and rinse your fingers, your hands, and your forearms. Keep your fingers up in the air and don't touch anything. Have an assistant shut off the sink for you. Your hands are now clean and ready for gloving. Have an assistant bring you your towel. Steer clear of any surfaces. Let the towel fall over the palm of the left hand and use the first quarter of the sterile towel to dry your entire hand. Use the second quarter of the towel to dry the left forearm and elbow. Drape the third quarter of the towel over the palm of your right hand and use that corner to dry your right hand. Then again, use the fourth quarter to dry your right forearm and elbow. You're now ready for gowning. Take your sterile gown from your pack and pick it up by the shoulders, allowing it to gently unfold in front of you. Be sure to never touch the outside. Slip one hand into each sleeve and push up, but not through, the cuffs. Touching only the inside of the back of the gown, a non-sterile assistant should pull the gown over the shoulders and secure the ties in the back. For gloving, there are two different methods you can use. The first method is closed gloving. With your gown covering your fingers, use your right hand to remove the left glove. Hold your left hand palm up, fingers straight. Lay the glove on your left wrist and grip the cup with your left hand. Make a fist with your right hand and stretch the glove over your left fingertips. Keeping your left fingers straight, pull down the glove. The second method is open gloving. Start by pulling your hand through the cuffs. With the pack of the gloves facing forward, pick up the right glove with the left hand, touching only the inner part of the glove. Pull the glove onto the right hand, leaving the cuff folded back. Slide the glove fingers of the right hand under the cuff and pull onto the left hand. You're now ready for surgery.